Imagine yourself savoring a delicious plate of undercooked or raw pork, accompanied by a robust red wine. You appreciate every bite, unaware that your pleasure might conceal a risk to your health. This food is a common choice in many cultures, but there is a silent danger that many people are unaware of: Taenia solium, or pork tapeworm. Consuming undercooked or raw pork may pose a risk to your health. This is due to the presence of the parasite Taenia solium, known as the pork tapeworm. In this video, we will explore the dangers of consuming undercooked pork, the modes of contagion, and the symptoms the body presents, especially in cases of neurocystic. If you enjoy content like this and want to learn more about health, food safety, and much more, subscribe to our channel. Click the subscription button and activate the bell icon to not miss any news. Without further ado, let's get started. The consumption of undercooked or raw pork may pose a risk to human health due to the presence of the parasite Taenia solium, known as the pork tapeworm. This tapeworm is capable of developing in our bodies, becoming a serious public health problem in many parts of the world. The infection can occur not only in conditions of poor hygiene but also in areas where meat inspection and sanitary practices are rigorous. This is because Cysticerci, the larvae of Taenia solium, may be present in undercooked or raw meat, regardless of the place of origin. Once ingested, these Cysticerci can settle in the human gastrointestinal tract and, in certain cases, migrate to other parts of the body, such as the brain. The infection can lead to neurocysticercosis, a severe condition that may result in severe neurological symptoms, including seizures and epilepsy. Although neurocysticercosis is more common in developing countries with inadequate sanitary practices, cases of infection have also been reported in developed countries, including the United States and Europe. Therefore, it is essential to be cautious when consuming pork, ensuring that it is well cooked to protect your health. Prevention of Taenia solium infection requires When ingested, the eggs of Taenia solium develop into larvae, Cysticerci, in the human gastrointestinal tract. These larvae, commonly found in undercooked or raw pork, can settle in the small intestine, where they develop into adult worms. These, in turn, can release eggs that are excreted in feces. Cysticerci can also migrate to other parts of the body, such as muscles, liver, lungs, and brain, where they develop into larvae that form cysts. The brain is one of the organs most affected by Taenia solium. When larvae reach the brain, they can form cysts that cause an inflammatory response. If the cysts compress important areas of the brain, or if there are many cysts, severe neurological symptoms, including seizures and epilepsy, can occur. This condition is known as neurocysticercosis and is one of the most common causes of epilepsy in endemic regions. Neurocysticercosis is a serious disease and can be fatal if not properly treated. In addition to neurological symptoms, the infection can also cause complications such as strokes, brain edema, and death. Taenia solium infection can occur in people of all ages, but children and young people are more likely to develop severe complications, as their immune system is not yet fully developed. It is important to note that neurocysticercosis can be fatal if not properly treated. Therefore, anyone experiencing unexplained neurological symptoms, especially seizures, should seek immediate medical help. Moreover, it is crucial to understand that Taenia solium infection does not only occur in areas with inadequate ways of contagion through the ingestion of pork or derivatives. Taenia solium contagion generally occurs through the ingestion of undercooked or raw pork containing Cysticerci, the parasite's larvae. When the contaminated meat is ingested, the Cysticerci develop into adult worms in the human small intestine, initiating the infection cycle. Adult worms produce eggs that are excreted in human feces, restarting the cycle. If infected feces contaminate the environment, especially water or food sources, other individuals can become infected. In addition to undercooked or raw pork, other derivatives can be a source of infection. Products such as sausages, salami, and ham, which are made from infected pork and not properly treated during manufacturing, may contain Cysticerci. Therefore, it is important to ensure that these products are produced in compliance with hygiene practices and sanitary regulations. Furthermore, even in places where sanitary inspection is strict and hygiene practices are followed, there may still be a risk of contagion if pork is consumed raw or undercooked. This is because Cysticerci may be present in pork even after undergoing rigorous sanitary inspections, especially if the meat is not fully cooked. Symptoms and diagnosis. The symptoms of neurocysticercosis vary depending on the number, size, and location of Cysticerci in the brain or central nervous system. Symptoms can be mild or severe and, in some cases, can be fatal. The most common neurological symptoms include seizures, severe and prolonged headaches, dizziness, blurred vision, lack of balance, fatigue, difficulty sleeping, light sensitivity, and dizziness. Other symptoms may include nausea, vomiting, loss of appetite, weight loss, fever, neck stiffness, and changes in personality or behavior. The diagnosis of neurocysticercosis is usually based on a combination of clinical exams, imaging tests, and blood tests. Imaging tests, such as computed tomography, CT, or magnetic resonance imaging, MRI, are essential tools for detecting and diagnosing the infection. These tests can show the presence of Cysticerci in the brain or central nervous system, as well as the extent of the infection and damage to brain tissue. Blood tests can be used to detect the presence of specific antibodies or antigens from Taenia solium in the blood, indicating the presence of the parasite in the body. Moreover, the diagnosis of neurocysticercosis usually requires a careful evaluation of the patient's medical history, including neurological symptoms, exposure to risk factors, travel history, and eating habits. The patient's physical examination can also help identify signs of infection, such as neck stiffness, signs of meningeal irritation, and signs of central nervous system impairment. In some cases, it may be necessary to perform brain biopsies or other invasive procedures to confirm the diagnosis. Biopsies are usually performed when there is suspicion of a malignant brain lesion or other severe condition that can cause symptoms similar to neurocysticercosis. It is important to note that the diagnosis of neurocysticercosis can be challenging, as symptoms can be nonspecific, and the results of imaging tests can be ambiguous. Therefore, it is important for healthcare professionals to consider neurocysticercosis as a possibility when evaluating patients with unexplained neurological symptoms, especially if there are significant risk factors, such as a history of travel or exposure to known sources of infection. Early identification and immediate treatment of neurocysticercosis are crucial to preventing severe complications. Prevention. Preventing Taenia solium infection is essential to avoid the occurrence of neurocysticercosis, a severe condition that can cause permanent neurological damage or even death. Here are some important measures that can help prevent infection. 1. Cook pork thoroughly. Make sure pork is fully cooked to an internal temperature of at least 71 degrees Celsius 160 degrees Fahrenheit before consuming it. This is especially important if you are in areas where neurocysticercosis is common. 2. Avoid consuming raw or undercooked pork. Even in places with high sanitary inspection, it is possible for pork to still contain cysticerce, so avoid consuming raw or undercooked pork. 3. Personal hygiene. Wash hands frequently, especially before preparing food and after using the bathroom. This can help prevent parasite spread. 4. Food and environmental hygiene. Thoroughly wash food before consuming it, especially fruits and vegetables. Avoid drinking untreated or unfiltered water. 5. Sanitary inspection and quality control. Make sure the pork you consume is inspected and approved by a sanitary authority. This can help ensure the meat is free of cysticerce. 6. Education and awareness. It is important to educate people about the risks associated with consuming raw or undercooked pork and proper hygiene practices during food preparation and consumption. 7. Proper treatment of teniasis. If you or someone you know has teniasis, it is important to seek appropriate medical treatment to prevent environmental contamination by Taenia solium eggs. 8. Avoid feeding pigs with food scraps. This can increase the risk of infection in animals, which can, in turn, increase the risk of human infection. By following Throughout this video, we have explored the relationship between the consumption of raw or undercooked pork and the risk of Taenia solium infection, a parasite that can lead to neurocysticercosis, a severe neurological condition. We discussed the different stages of infection, the symptoms associated with neurocysticercosis, and ways to prevent infection. Pork is a popular choice in many cultures, but it is important to be aware of the health risks that may be associated with it. Remember, Taenia solium infection does not only occur in conditions of poor hygiene. Even in places with strict sanitary inspections, raw or undercooked pork can still pose a risk of infection. Therefore, it is essential to be cautious when consuming pork and follow the recommended precautions. By sharing this knowledge with your family and friends, you can help promote safer food practices and protect everyone's health. Don't forget to subscribe to the channel to stay informed about health and well-being. Thank you for watching, and until next time.